Part A. Extract 1. Questions 1 to 12. You hear a nurse talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. I see you've come in today because of some issues with your skin. Could you describe the symptoms you're experiencing?
Good morning. Yes, it started about a month ago. I've been getting these small, itchy blisters on my hands and fingers. Sometimes they get really painful, especially when I wash my hands or use soap. The skin feels dry and cracked too. It's been really uncomfortable, and it seems to be getting worse. Good morning. Yes, it started about a month ago. I've been getting these small, itchy blisters on my hands and fingers. Sometimes they get really painful, especially when I wash my hands or use soap. The skin feels dry and cracked too. It's been really uncomfortable, and it seems to be getting worse.
I see. It sounds quite uncomfortable. Mihira, are you having any difficulty sleeping or doing your daily activities because of it?
Yes, it's definitely affecting my sleep. The itching is worse at night, so I wake up scratching, and it's hard to get back to sleep. During the day, I work with computers, so typing feels painful when the blisters are swollen. It's really affecting my concentration at work. I've also noticed that my hands get swollen sometimes, which is frustrating.
I can imagine how frustrating that must be. Have you tried any treatments or medications so far?
Yes, I've tried a few things. I've been using over-the-counter hydrocortisone cream, but it doesn't seem to help much. I also tried an antihistamine because I thought it might reduce the itching, but it didn't make much of a difference either. I've been moisturizing with Vaseline and coconut oil, but nothing seems to work for long.
All right. So, none of them have provided significant relief.
Exactly.
Oh, I see. Well, Mihira, do you have any family history of skin conditions or allergies?
Not skin conditions exactly, but my father has asthma and my mother suffers from seasonal allergies, especially hay fever. I've had mild eczema as a child, but it was never this bad.
Thank you for sharing that. Based on what you've described in your history, it sounds like you may have a condition called dyshydrotic eczema. Mihira, it can be triggered by stress, allergies, or exposure to irritants like soaps or detergents.
I've never heard of that before.
Yes, it's a type of eczema, and it can be chronic for some people, meaning it may come and go over time. Now, before confirming the diagnosis, I'd like to plan a couple of tests. We may need to do an allergy patch test to rule out any allergic reactions that could be triggering the flare-ups. We could also perform a skin scraping test to ensure there's no fungal infection present, as the symptoms can sometimes overlap.
Okay, that sounds reasonable. What kind of treatment would I need if it is diagnosed?
The treatment typically involves a combination of topical steroids to reduce inflammation, such as stronger corticosteroid creams or ointments, which are more effective than the over-the-counter ones you've been using. Mihira, in some cases, we might prescribe an oral antihistamine fexofenadine to manage the itching, and occasionally, if it's severe, a short course of oral steroids might be necessary.
And how long would I need to be on these treatments?
For topical steroids, you'd likely apply them for 1 to 2 weeks, depending on the severity. The skin usually improves after a week, but it's important to complete the course to prevent a relapse. In terms of risks, prolonged use of topical steroids can thin the skin, so we use them cautiously. That's why regular checkups will be essential.
What about the itching and swelling? Will that go away quickly? Yes, Mihira, the itching and swelling should subside within a few days of starting treatment. Alongside the steroids, I'd recommend soaking your hands in cold water or using cold compresses to soothe the itching. And, of course, moisturizing frequently with a fragrance-free, thick emollient will help.
All right. I'll give it a try. Thank you so much for your help.
You're welcome.
Extract 2. Questions 13 to 24. You hear a neurologist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. I understand you've been experiencing some persistent symptoms. Could you please describe them in detail?
Good morning, Dr. Miller. Yes, I've been really worried about these symptoms. It started a few months ago with muscle twitches, especially in my arms and legs. At first, they would come and go, but now they seem almost constant. I also feel much weaker, like I can't lift things as easily as before. Even simple tasks, like holding a cup or buttoning my shirt, are becoming difficult. I've also noticed that my speech has changed, sometimes it's slurred, and I find myself struggling to form words.
I see. Those sound like concerning issues. Mihira, can you tell me more about any other difficulties you've been facing?
Yes, there's more. Lately, I've been feeling this tightness in my throat, and it's becoming harder to swallow certain foods. I've choked a few times, which has been quite scary. My balance is also off, I've been tripping over my feet more often. I also feel exhausted all the time, like I don't have the energy to get through the day. It's affecting my job and personal life a lot. My muscles feel stiff, almost like they're cramping but without the pain. Just a constant, uncomfortable stiffness.
That sounds very distressing, Mihira. Let's go through your medical history next. Have you been diagnosed with any other conditions in the past, or are you currently taking any medication?
I don't have any major conditions, but I was prescribed gabapentin a few months ago because my GP thought it might help with the muscle twitches and nerve pain I was experiencing. I took it for about 3 months, but it didn't seem to do much, so I stopped. I've also been taking some over-the-counter vitamins like B12 and magnesium, but I can't say if they're helping. I also tried physical therapy, but it was mostly for stiffness and balance issues. The therapist suggested some exercises, but I haven't seen much improvement. I also tried acupuncture a couple of times, but I didn't feel much of a difference afterward.
Thank you for sharing that, Mihira. Has anyone in your family had similar symptoms, or has there been any history of neurological disorders?
Well, my father passed away from Parkinson's disease about 5 years ago, and my grandfather had some kind of muscle wasting disease, but I'm not sure what it was called. Other than that, I don't think there's anything else significant in the family.
That's helpful to know. Given your symptoms, it's possible that you may be experiencing something more serious, such as amyotrophic lateral sclerosis. This condition affects the nerve cells responsible for controlling muscle movement, which would explain the weakness, cramping, and speech difficulties.
Oh, I've heard of that. It's a very serious condition, isn't it? What happens next?
Yes, Mihira, It is a serious neurodegenerative disease, but there are ways we can manage the symptoms and improve your quality of life. We'll need to run several tests to confirm the diagnosis. I'd recommend starting with an electromyography to assess the electrical activity of your muscles, and a nerve conduction study to see how well your nerves are functioning. We'll also do an MRI to rule out other potential causes, like multiple sclerosis or a spinal cord issue.
Okay, and if it is diagnosed, what kind of treatment options are available?
While there's no cure, we can offer treatments to slow the progression and alleviate symptoms. We may start you on a medication called riluzole, which can help reduce the damage to motor neurons. Physical therapy and speech therapy will also be important for maintaining as much function as possible. Another drug, edaravone, may also help slow progression in some patients.
That sounds like a lot to take in, but I appreciate the information. When should I come in next for the tests?
Mihira, I'd like to see you again in a week. Depending on the results, we'll plan further treatment and management strategies. We'll discuss nutrition options too, given your difficulty swallowing, to ensure you maintain your strength.
Thank you, Dr. Miller.
You're welcome, Mihira.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a doctor called Mihira talking to a colleague. Now read the question.
Dr. Milan, I'm concerned about Mr. Rogers' recent blood test results. His liver enzymes are elevated, and his bilirubin levels are abnormal.
That's concerning, Dr. Mihira. Have you ruled out any underlying medical conditions?
Yes, we've conducted a thorough evaluation, including imaging studies and blood tests. There's no evidence of a liver infection or other acute condition.
Could it be related to his medications? Sometimes, certain medications can cause liver damage.
That's a possibility. We'll need to review his medication regimen and consider adjusting or discontinuing any potential culprits.
Mihira, we should also monitor Mr. Roger closely for any signs of jaundice or other symptoms of liver dysfunction.
Absolutely. I'll inform Mr. Roger about the abnormal lab results and discuss the next steps. We may need to consult with a hepatologist for further evaluation. Now look at question 26. You hear a nurse called Mihira talking to a patient. Now read the question. Mr. Roger, I understand you're experiencing pain in your wrist. Can you describe the pain and when it started?
It's a sharp, throbbing pain that started a few days ago. Mihira, it's worse when I try to move my wrist.
Have you experienced any recent injuries or trauma to your wrist?
I don't recall any specific incidents.
It's important to rule out any underlying conditions. Have you noticed any swelling, redness, or warmth around the wrist?
Yes, Mihira, there's a little bit of swelling and redness.
We'll need to assess the range of motion in your wrist and examine for any signs of tenderness or deformity. I'll also recommend an X-ray to rule out any fractures or dislocations.
Will an X-ray be painful?
The X-ray procedure itself is usually painless. However, you might experience some discomfort from the positioning of your wrist during the scan.
Now look at question 27. You hear a nursing manager called Mihira talking to a staff nurse. Now read the question.
Nurse Milan, we've been seeing an increase in medication errors on our ward. It's crucial that we identify the root causes and implement measures to prevent these mistakes.
That's concerning Mihira. What are some of the common factors that contribute to medication errors?
One common factor is interruptions during medication administration. When nurses are interrupted, it can increase the risk of mistakes. Another factor is similar drug names, which can lead to confusion.
I agree. It's also important to ensure that staff members are adequately trained and knowledgeable about the medications they are administering.
Absolutely. We should review our training programs and identify any areas for improvement. Additionally, we can implement double-checking procedures to verify medication orders and administration.
Are there any technological solutions that could help prevent medication errors, Mihira?
We can explore the use of barcode scanning systems to verify medication orders and ensure the right medication is given to the right patient at the right dose.
Now look at question 28. You hear a junior doctor called Mihira talking to a supervisor. Now read the question.
Dr. Milan, I'm having some trouble with the new diagnostic software. I'm not sure how to interpret some of the results.
That's understandable, Dr. Mihira. The software can be complex. What specific issues are you encountering?
I'm having difficulty analyzing the images from the CT scan. I'm not sure if I'm identifying all the abnormalities correctly.
That's a common challenge when learning to use new software. Let's review some of the key features and techniques for interpreting CT scans.
I've been trying to follow the training manual, but I'm still struggling with certain aspects.
Don't worry, Dr. Mihira. Learning new software takes time. I'm happy to provide additional guidance and support. We can schedule some extra training sessions if needed.
Thank you. I appreciate your help. I'm eager to become proficient with this software. Now look at question 29. You hear a doctor called Mihira conducting a morning meeting. Now read the question. Team, I want to discuss the importance of proper handling and disposal of personal devices in the healthcare setting. These devices can harbor bacteria and viruses, contributing to the spread of infections.
That's a good point, Mihira. I've seen staff using personal devices in patient care areas.
Using personal devices in patient care areas can increase the risk of contamination. We need to establish guidelines for the use of personal devices in the hospital.
Should we prohibit the use of personal devices altogether?
That might be impractical. Instead, we can designate specific areas for the use of personal devices. We should also encourage staff to clean and disinfect their devices regularly.
What about patient-owned devices, Mihira? Should we allow patients to use their personal devices in the hospital?
We can establish guidelines for the use of patient-owned devices. Patients should be encouraged to clean and disinfect their devices before and after use. We can also provide designated charging areas to minimize the spread of germs.
Now look at question 30. You hear a community nurse called Mihira talking to a GP. Now read the question.
Dr. Milan, I'm concerned about Mr. Rogers' recent decline in health. He's been experiencing increased fatigue, confusion, and loss of appetite.
That's concerning Mihira. Have you noticed any other changes in his behavior or symptoms?
Yes, he seems to be losing weight and has difficulty remembering things. He's also been less active than usual.
Those symptoms suggest a potential underlying medical condition. We should schedule a comprehensive assessment, including blood tests and a physical examination.
I've already scheduled an appointment for Mr. Roger. I'm also concerned about his living situation. He lives alone and may need additional support.
That's a good point, Mihira. We should assess his functional status and determine if he requires any assistance with daily living activities.
I've been coordinating with his family to ensure he's receiving the necessary support at home. However, I think it might be beneficial to involve a social worker to evaluate his needs and connect him with appropriate resources.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a Dr. Mihira and an interviewer. Dr. Mihira, thank you for joining us today. Let's dive into your latest research on sleep patterns. Could you tell us what the study primarily focuses on?
Thank you for having me. It's a pleasure to discuss the research. Now, to understand the scope of our study, you have to appreciate the multifaceted nature of sleep itself. While the surface-level assumption might be that we simply examined the sleep duration or the quality of rest, our focus actually extends far beyond that. We delved into the intricate relationship between the neural mechanisms that regulate sleep cycles and their impact on cognitive functions, specifically, how variations in these cycles influence memory consolidation, emotional regulation, and even long-term mental health. This involves examining sleep architecture, the stages of sleep like REM and deep sleep, and their subtle interplay with external stimuli such as light exposure, stress, and dietary habits. The study wasn't confined to a single age group or demographic either, which added layers of complexity to our findings.
It sounds like there was a strong need for such a study. Dr. Mihira, could you explain why this research was conducted in the first place?
Indeed, the impetus behind this study came from the alarming rise in sleep disorders in modern populations, particularly among younger individuals and those in high-stress occupations. But more than just cataloging the increase in insomnia or irregular sleep patterns, we wanted to investigate the underlying mechanisms contributing to this shift. You see, sleep science has long understood that poor sleep is correlated with anxiety, depression, and cognitive decline, but the challenge was to pinpoint whether the chicken or the egg comes first, metaphorically speaking. That is, we wanted to discern whether cognitive and emotional disturbances are caused by poor sleep, or if existing mental health issues lead to disrupted sleep. A clearer understanding of this cycle could provide new avenues for therapeutic interventions. Moreover, with the global rise in artificial light use, the omnipresence of screens, and irregular working hours, we felt it was vital to conduct a comprehensive study to assess how these modern factors were exacerbating sleep problems.
That makes perfect sense. Now, from a methodological perspective, what were the requirements for the study? Dr. Mihira, how did you go about structuring it?
Structuring the study was a task of its own. Since we were tackling such a broad set of questions, the requirements went beyond just gathering subjects with different sleep habits. First, we needed a sample size large enough to represent different populations. This included age groups ranging from teenagers to elderly individuals, people with varied lifestyle habits, and individuals from both urban and rural environments. Furthermore, the study demanded consistent, reliable monitoring of the participants' sleep over a long period. We used polysomnography, a multiparameter test, as well as EEG monitoring, and even advanced wearable technology to collect real-time data. But it wasn't just about recording their sleep patterns. We also had to account for their waking behaviors, which required regular cognitive testing, mood assessments, and even tracking external factors like their exposure to daylight, screen time, and stress levels. This all amounted to an intricate system of interrelated data points that needed careful, ongoing calibration.
That's quite a comprehensive approach, Dr. Mihira. How did the study develop as it progressed? Were there any unexpected findings?
Yes, the study evolved in ways that were unexpected. Initially, we thought we would merely be confirming pre-existing hypotheses about the correlation between sleep quality and cognitive function. However, as the study progressed, we uncovered nuanced data suggesting that the relationship between REM sleep and emotional resilience was more significant than we had anticipated. While REM sleep has always been associated with dreaming and memory consolidation, our findings indicated that individuals with longer REM phases were better able to regulate their emotions, even under significant stress. The unexpected part was how quickly these effects manifested. Even after just a few nights of disrupted REM sleep, we saw substantial declines in emotional stability. Another development was the discovery that different demographics reacted differently to disrupted sleep. For example, younger participants showed more resilience to short-term sleep loss, while older individuals exhibited pronounced cognitive deficits after just one night of poor sleep. This was one of the major findings that helped shift our focus halfway through the study to look more closely at how age and sleep interplay, particularly in terms of emotional and cognitive health.
Interesting. Dr. Mihira, was there a particular turning point during the study that you would consider pivotal?
There was, in fact, a key turning point, and it wasn't something we had anticipated at all. About halfway through the study, we noticed a significant divide between the results of participants who had a history of sleep disorders versus those who did not. Participants with chronic insomnia or irregular sleep patterns displayed a distinctly different neurological response to stimuli, even when they managed to get a full night's rest. This discovery led us to question whether long-term poor sleep actually alters the brain's processing abilities, making it harder for individuals to recover normal cognitive function, even when they do sleep well. This was pivotal because it shifted our research into a different gear. We had to account for long-term sleep history, not just current sleep patterns, which led to the development of new, longitudinal aspects of the study. We then incorporated a neuroplasticity component, examining how sustained poor sleep might actually change the brain's ability to recover, which was a significant finding for the field.
Fascinating. So how do you think the study's findings will be useful moving forward, Dr. Mihira?
The implications of the study are far-reaching, but in particular, it opens up new doors for both preventative and rehabilitative sleep therapies. For one, understanding that long-term sleep deprivation alters the brain's ability to recover sheds light on why some individuals struggle with cognitive therapies for sleep issues. This means we can better tailor treatments to target not only immediate sleep disruptions but also the underlying neuroplastic changes caused by years of poor sleep. Additionally, Our findings about REM sleep and emotional resilience suggest that improving REM sleep could be a new focus for therapy, especially for those dealing with high-stress environments. We're also looking into how these findings can contribute to policies on work environments and school schedules, especially in professions and age groups that suffer the most from sleep deprivation. In the long term, we hope these insights will lead to innovations in wearable tech that can provide real-time sleep optimization strategies, giving people personalized feedback on how to improve their sleep health based on the dynamic needs of their brain and body.
Now look at Extract 2. Questions 37 to 42. You hear a nurse, Jordan Wilson, talking about the workplace. You now have 90 seconds to read questions 37 to 42.
Hello everyone. I'm Jordan Wilson, a registered nurse working at Mihira Health and Wellness, and I'm excited to share my experience at this outstanding healthcare facility. I'll walk you through what we do here, describe our workplace, how we support patients, the importance of working with a multidisciplinary team, and finally, how all of this impacts our patients and my own career growth. Let's dive right in. As a nurse at Mihira Health and Wellness, my responsibilities extend far beyond the traditional understanding of nursing care. While patient care is, of course, central to what I do, my role also involves creating and implementing care plans, conducting health assessments, and providing both emotional and physical support to patients. We work with diverse patient populations dealing with chronic conditions, mental health challenges, and those in rehabilitation from injuries or surgeries. The job isn't limited to bedside care. We focus on a holistic approach, addressing not only medical issues but also the emotional and social well-being of the patient. Our daily activities involve close monitoring of vital signs, administering medications, and collaborating with family members to ensure comprehensive care. Additionally, we spend time educating patients about their health conditions and wellness strategies to improve their quality of life beyond their stay with us. Mihira Health and Wellness is much more than a traditional clinic or hospital. It is an integrative health facility that emphasizes wellness, rehabilitation, and preventative care as much as acute medical treatment. Our workplace is designed with an emphasis on healing environments. Instead of the cold, clinical setting you might find in a conventional hospital, Mihira offers a space filled with natural light, comfortable patient rooms, therapy gardens, and dedicated spaces for both mental health and physical rehabilitation. It combines advanced medical technology with a nurturing environment, which is essential for patient recovery. It's not just a place for healing from physical ailments, it's a space where patients and staff alike feel supported in their mental, emotional, and spiritual well-being. This dynamic makes Mihira unique, as we prioritize the holistic needs of our patients, blending cutting-edge care with compassionate support. Our approach to patient care revolves around personalized care plans. When a patient arrives, we don't just address the immediate health issue. A team, including doctors, nurses, physical therapists, psychologists, and nutritionists, develops a customized treatment plan tailored to the patient's individual needs. These care plans are reviewed and updated frequently to reflect the patient's progress or any changes in their condition. We plan our work by setting realistic, measurable goals that cover every aspect of the patient's health, physical recovery, mental stability, and even social reintegration, if necessary. We are proactive, aiming to prevent complications rather than just responding to them. Our workplace also operates under a model that encourages patient empowerment. We don't simply administer care, we involve patients in their own recovery process, teaching them how to manage their conditions and understand the steps needed to maintain wellness at home. Teamwork is at the core of everything we do at Mihira. Nurses, doctors, specialists, therapists, social workers, and other healthcare professionals constantly coordinate to ensure that every patient receives holistic care. This isn't just about communication, it's about synchronization. For example, as a nurse, I often liaise with the physiotherapists to ensure that my patient's medication schedule aligns with their therapy sessions. We have regular interdisciplinary meetings where we review the patient's case, assess progress, and adjust treatment plans as needed. This close coordination minimizes risks of overlapping treatments or gaps in care. Furthermore, Mihira emphasizes collaborative technologies. We utilize shared electronic medical records, EMR, systems to document and share updates on patient care, ensuring that everyone on the team is informed of any changes. This cohesive approach not only supports patient care but also enhances professional development by encouraging us to work outside the traditional silos of healthcare. The work we do here has profound and lasting effects on the lives of our patients and their families. Patients frequently come to Mihira facing significant health challenges. Some are recovering from life-threatening conditions, others are battling long-term illnesses or struggling with mental health. Our commitment to holistic care means that we don't just focus on short-term recovery, we aim to improve their overall quality of life. Patients often leave with not just improved physical health but also a stronger sense of emotional well-being. Families, who may initially come overwhelmed by the patient's condition, are relieved to see the positive changes, and they frequently express how our integrative approach has given them hope and strength. Moreover, our attention to patient education means families are well prepared to assist their loved ones post-discharge. This not only eases their anxiety but also fosters long-term well-being for the patient outside the clinic setting. Working at Mihira has significantly shaped my professional journey. I have had the opportunity to expand my skill set beyond traditional nursing into areas such as mental health counseling, rehabilitation, and even nutrition. Mihira promotes continuous professional development, offering training sessions, certifications, and opportunities for career advancement. The multidisciplinary environment has honed my ability to work collaboratively, while the holistic approach to care has deepened my understanding of patient well-being beyond physical health. This workplace has helped me grow into a more rounded healthcare professional, equipping me with the tools to think critically, act compassionately, and apply a broad range of interventions to support my patients.
That is the end of your OET listening test. Now check the answers.